Welcome to Pelargos IVF's weekly podcast, where science meets clarity. I am Dr. Haris Karpouzis, the Scientific Director of Pelargos IVF, here to guide you through the fascinating world of fertility. Each week, we address one of your anonymously submitted questions and debunk a common fertility myth, cutting through misconceptions with evidence-based answers. Whether you're just starting your fertility journey, currently in treatment, or simply curious, we are here to provide knowledge and support. Let's dive into this week's episode.
What innovative protocols does Pelargos use for patients with poor ovarian response?
Okay, first of all, in Pelargos IVF, we kind of specialize in women that have poor ovarian reserve. Most of our clientele comes from women that are more than 40 years old, even though in many cases, the poor ovarian reserve happens even in women that are less than 40 years old. We do apply innovative and personalized protocols for women that are poor responders. Keep in mind that the success of an IVF depends mainly on the personalization of a protocol. And that's what we are doing. We usually use the short antagonist protocol. We vary the doses on high doses or low doses depending on the number of the antral follicles, depending on the AMH, and in every single ultrasound during the ovarian stimulation, we change the doses so that we can personalize the result. We do have more innovative protocols in case this does not work, like for example, double stimulation protocols in one cycle. In some cases, it can be very important because it helps you get more eggs in one go, in one cycle, and it wins time for you. We also have more special protocols, like a combination of pills and injections, and other protocols as well that we personalize to each case.
A common myth, infertility is mostly a female problem.
No, infertility is not mostly a female problem. Actually, female factor is in about 30% of the cases. About 30% of the cases is only male factor, and combined with the female factor, it might be even more than that. And about 30% of the cases, you cannot even find the factor, which is unexplained subfertility. So the male factor as well is very important, either as an isolated factor or as a contributing factor in subfertility. That's it for this week's episode by Pelargos IVF. Submit your anonymous questions for next week and share this podcast with someone who might need it. Thanks for tuning in. See you next time.